So my name is Brooke. I am the Regional Director of Wellness for Civitas Senior Living. I oversee 13 communities in my local area and help our wellness directors who are in our communities help manage their day-to-day business. So I started out with Civitas Senior Living as an executive director in training. Actually, I wanted to get into the operational side of the company, but then quickly realized that wellness and nursing is definitely where my passion lies. And so I became a wellness specialist for Civitas Senior Living shortly after that, and would go and travel around and sit in different buildings where there was a wellness director opening. So I was practically like a traveling wellness director. And I would support those communities, help with the hiring processes and taking care of those residents. And then I became the director of wellness initiatives for our company. So I oversaw all of the different initiatives that our wellness department has. So like any scheduling, we had a new scheduling platform that we were launching that I oversaw, some different pharmacy things that I oversaw, new pharmacies rolling out in some of our communities. And then after that, I became the regional memory care specialist. I went in and would help out all of our different memory care communities. We do have secured memory cares in most of our communities that help those living with dementia really create the best life for them during those stages of their dementia. I think, coming out of nursing school, I just really wanted to take care of people like most nurses do. And my draw was towards seniors. I always was really close with seniors in my life personally, and wanted to care for other people's family members. So that drew me to senior living in general. And then what drew me to kind of catalyst into these next positions, like you mentioned, was really my want to do more than just clocking in and clocking out and going home. Because that's what I was doing a lot in skilled nursing whenever I worked there. I wasn't getting to be a part of my patients' lives, outside of my clocking in and clocking out. And I then worked night shift, and I wanted to, really learn more about the people that I was caring for, and senior living is great for that. So like I mentioned earlier, we do a lot of the staffing for our med aides and our caregivers. So it would include hiring, it would include making a schedule. It also includes obviously taking care of our residents. So coordinating those home health hospice visits, doctors, things like that. And then any new medication changes or new medication orders, we would send those to the pharmacy, ensure that we get those back. Then it includes things like part audits and chart audits, and making sure that we have all of the correct documentation and paperwork that we're supposed to have, and that we have all of the medications in the building that we're supposed to have. So, really, we're looking at the building as a whole, and our LVNs do the same thing as well. An entry-level position would make anywhere between $60,000 and $65,000 a year. Median level, probably somewhere around the $70,000 range. And then with many years of experience, and depending on the job market and where you are specifically, I've seen LVNs make $80,000 plus, and it really just depends on that experience though as well. The program I did was a 10-month long program. Some of them are as long as a year, and then I have seen some programs that are kind of part-time programs that can take up to a year and a half to complete. But generally, I would say that 10 months to a year is pretty normal for an LVN program. The program that I took and that I've seen a lot of people take, whether that be the 10 months to a year program, is pretty full-time. Whenever I went to school, it was about 8 to 5 every day. On some of our clinical days, it was about 6:30 to 3:30. So it was Monday through Friday full-time. It was a job, and then the studying and everything that came after that was like another full-time job, it felt like. So but you do have to go to school, and then you will have to take your boards after that and pass your boards and become licensed with the Board of Nursing. I would say the technical skills are really going to be the computer skills. While there are some companies that are still using a lot of paper, in my company specifically, we are very digital and have a lot of great programs, but you have to be able to use those computer skills and those critical thinking skills to navigate those programs and be successful with those programs. So, for example, we have our electronic health record that we use, as well as our EMR, so our electronic medication administration record. And then we also use a program for scheduling. So for our med aides and our caregivers that we oversee, we use an electronic program for that as well. So really being able to navigate and having those computer skills would be the biggest thing as far as technically what you would be doing in this role. In this role, like I mentioned, you are going to be talking not only with home health, hospices, doctors, our residents, families, our staff members. So communication is a big thing to have. That being said, I think part of communicating is also listening. So listening is a very something that is going to be really important as well. And I think that a lot of nurses get taught this during nursing school, and it's something that comes naturally for a lot of people, but empathy would be another soft skill that I would say. And then the last one, and this is one specific to the roles that we work in, or that I work in specifically, is people management. A lot of the times in nursing school, I personally didn't learn people management in nursing school. I learned how to care for people, but I didn't learn how to manage people. So that was something that was new to me, and honestly a little bit difficult. And so that would be what I would say is the hardest one to navigate, maybe as a new nurse who hasn't had experience with people management previously. So in general, I would say that the most rewarding thing is taking care of the people that you are caring for. So building those relationships, learning their stories. A lot of the times you become really close with those people that you're caring for. And in that same aspect, I would say the most challenging part is losing someone that you have become close with. Sometimes you will end up taking care of someone for years, and you'll have known them for 3, 5, 7 years, and whenever they end up passing away, it's kind of like a part of your family has passed away too. So building those relationships is the most rewarding, but then the passing of that person can also be the most challenging. I definitely think that you will definitely see more LVNs in the hospice, home health, senior living, skilled nursing, assisted living, memory care, than you probably will hospitals. Now, that's not to say that there aren't LVNs in hospitals. I've known some LVNs who have worked at hospitals for 20 years. And then I have also known some LVNs more recently in more rural settings where they have been hired on at hospitals, but I would say generally you'll see them more in the other aspects, like the home health and hospices. I would say research is your best bet. If you go onto the Board of Nursing's website, if you look at the Texas Board of Nursing's website, they have a pamphlet that has all of the programs listed across the state of Texas. Research the schools that are maybe closest to you, or the schools that you're looking to want to go to, and look into those programs. Some of the programs will require prerequisites, for your LVN, and some of them just require entry testing to get your LVN. And the prices range drastically, from different private schools to, things like a community college or career college. So I would say research. Once you get done with LVN school, there are many of different areas you can go into. I have known people who go straight back to school to get their RN, and that is perfectly great and is super exciting for those who get to do that. The other opportunities that I see for people to do are to go and start working. And there are many different areas you can go start working in, such as skilled nursing, home health, hospices, pediatrics even has home health that they work with. So you can, if kids or something you're wanting to go work with, there's pediatric home health. I know that this is kind of a little bit different, but there's great jobs at local jails and prisons, and then also skilled nursing and assisted living communities as well.